Family seeks R40 million from Health Department after tragic death outside Mpumalanga Hospital, by Satori News. In a distressing event that has shaken the community of Mpumalanga, the family of the late Lazarus Mathavele is seeking R40 million in compensation from the Health Department, alleging medical neglect that led to Mathavele's tragic death outside Matikwane Hospital. The unfortunate discovery of the 57-year-old man, who was a source of financial sustenance for his family, has raised numerous questions and prompted legal action. Mathavele, who was contending with severe breathing difficulties, was admitted to the said hospital in early July, and after a brief discharge on the same day, was readmitted with persistent health challenges. His situation deteriorated, and on July 24th, the family was notified of his disappearance from the hospital premises. This news sent shock waves and prompted the family and hospital staff to launch an immediate search. The grim revelation of Mathavele's lifeless body, lying unresponsive by the roadside, clad only in his underwear with his belongings close by, was brought to the attention of the hospital by local residents. The cause of death was attributed to respiratory complications, an end that, according to his daughter Grace, could have been prevented with better care and supervision from the hospital staff. Grace expresses the devastation and the void left by her father, who was the primary earner for the family. According to Grace, the hospital officials met with the family post-funeral, offering apologies and to cover the funeral costs, a promise which remains unfulfilled, adding to the family's grievances. The department spokesperson, Christopher Nobella, refrained from providing a statement due to the impending litigation. The family's attorney, actor DJ Sibui, argues that the hospital's security and staffing protocols were drastically insufficient on the night of Mathavele's illusion, a flaw that could potentially be connected to his demise. Sibui has outlined the electronic security measures and staffing said to be safeguarding the ward where Mathavele was admitted, pointing out the hospital's oversight and slow response in the patient's disappearance as critical failures. The R40 million claim accounts for loss of familial support, psychological anguish, and emotional distress, coupled with compensation for the suffering preceding Mathavele's death and legal costs. This comes against the backdrop of the Health Department grappling with a staggering R5.6 billion in medical negligence claims, highlighting an ongoing crisis within the provincial healthcare system. The family's pursuit of justice and accountability steps into a broader conversation on healthcare negligence. The story of Lazarus Mathavele has become a poignant symbol for many suffering from the lapses in the health system. The coming legal proceedings are likely to further scrutinize the policies and practices of health institutions in the province. Thank you for choosing Satori News.